Good morning, everybody. Namaskar. My name is Dr. Indranill Basu-Ray. I'm a cardiologist and a cardiac-electrophysiologist. I'm also a professor of medicine at the University of Public and Public Health at University of Memphis, Tennessee. I'm also a visiting professor of cardiology and the head of integrative cardiology program at the All India Institute of Medical Sciences at Rishikesh. Um, Good evening, everybody in India. Good morning, everybody here in the US. So today I've been asked to give an overview of the latest update in research on COVID and also to understand this completely novel new virus that we have to deal with. I'd also go into some details which is unknown on what are the new things we learned about the virus in the last 1 week, including some of the latest trial that has taken place in the last 2 to 3 days about the latest in medicine. I'll talk a little bit about the different aspects of treatment that's being tried the world over, particularly in the US. Also talk a little about the vaccine, and then finally, I'll try to end on how you can protect yourself from COVID. And even if you get COVID, how you can protect from getting severe form of COVID, which has got high mortality. So let's start now. Please feel free to keep your questions so that at the end I will be free to answer questions as many as possible. So let's start with what is COVID. So COVID is the unknown virus that started appearing possibly around September, October, November in China, but China managed to hide it from the world, and we came to know about it around end of December, almost in January. Even in January, when we came to know about the virus, the initial note from the Chinese was that this is a virus with very poor human to human transmission, so it is not going to be a problem at all. And the sad part is the WHO, World Health Organization, also supported and parroted what China said. So the world was actually duped to believe that we are dealing with a very restricted problem. This problem will never go worldwide. And even if it goes worldwide, it will never be an epidemic, leave alone being a pandemic, because this is a virus that doesn't have much of a capacity to travel between humans. By the end of January, we slowly came to know that none of this is true, almost in the beginning of February. And then it got spread like wildfire to almost 100, over 100 countries all over the world. And today we are facing an epidemic with, today we are facing a pandemic with over 3 million cases all over the world, more than a million in the US, around 200,000 plus in Spain, Italy, around 160,000 in Germany, with over 200,000 deaths all over the world. In America, around 60,000 deaths. So India has a number of cases too, as you all know. So let's first try to understand what is this virus, where did it come? And the reason I'm trying to tell this is because we need to understand the pathophysiology. What is the future idea? What is the future behavior pattern we can expect from this virus? So at the beginning, we must be frank that we really do not know where the virus came from. But there is an increasing idea that the virus did not come from the seafood market at Wuhan that the Chinese government was trying to spread all over the world. So Chinese were trying to take attention away from another place from where this possibly came. There is some amount of evidence, and a lot of virologists all over the world who are specialists believe this virus leaked out of what is known as the Wuhan Institute of Virology. So Wuhan Institute of Virology is a grade 4, which is the highest level of virology research center in China. It is the only grade 4 virology research center in China, and based on their own tweet that they gave in 2018, if I remember correctly, they claimed they had over 1,500 highly dangerous viruses. So, a grade 4 lab is a lab that has the capacity to keep highly dangerous viruses. And that's what Wuhan claimed, that it has the capacity and it had some of the worst viruses. However, there are now leaked documents from different government sources in the US, UK, Canada, because most of Wuhan's facilities have been funded by the West. But however, despite being completely funded by the West, Chinese has been keeping the whole institute under wraps, and there is now enough indication that China did not follow appropriate guidelines to maintain safety, and the virus may have leaked from the Wuhan Institute of Virology to people who work in that virology institute, and from them to the common population, and then from common population, like a wildfire, it spread all around the world. Now, it's not very clear whether this particular virus is a bio terror virus, that is, people have played with the virus and it is biologically maneuvered. However, and that's a controversy on that. However, and I'm not a virologist, so I don't want to give my opinion, but I'll just give the opinion that has been there in the scientific um, forum, so that you yourself can decide whether there's a possibility that this virus could be a virus that's been tinkered about by people before it got released. So Luc Montagnier, as you know, is the Nobel laureate, one of the world's most famous virologists. He discovered the HIV virus, the other most dangerous virus, with which we have now a complete control, because there are hundreds and thousands of medicines to treat it. So he, according to him, it seems he claimed, it seems that a virus like this, which has got properties of HIV and other parasites like Plasmodium vivax, which is the causative organism in malaria, cannot be a natural virus. So, in all probability, it is a man-made virus. Other than that, there's been certain happenings at the Wuhan Institute of Virology, which has created a lot of discontent among top scientists and virologists for the last 2 years. Xu Shengli, who was one of the head of Wuhan, in 2015, she released a paper, and then a bunch of papers, where her work was how to modify the virus so that it can actually jump, how to modify a coronavirus so that it can actually jump from one species to the other. So obviously, you will understand that this virus has jumped, so-called, from bat to human being. So she was exactly working on this: how you could make a bat or other species virus change, like for example, changing their coat protein, so that they can easily jump species. Now, there is one more thing which proves that possibly did not come from the wet market in Wuhan, is because there are thousands and thousands of wet markets all over China. There's no reason why it should just come from the Wuhan wet market, number one. And number two, what is more important is that Wuhan, the viruses which the coronaviruses, which is supposed to have come from the bats that contain this coronavirus lives over 600 miles from Wuhan. So it is very rarely likely that this is the virus that is coming from 600 miles and infecting the seafood market, and from the seafood market, it is spreading all over the world. However, what is very disconcerting is the fact that not only have the Chinese hid the fact that there's a wildfire spread, and that's what America and a lot of scientists in America, and also in the political level in America, in Germany, in the United Kingdom, they're angry about, is not only has China hidden the fact, what it also did was that it made sure that flights from Wuhan to the rest of China was completely blocked. And that's why you can imagine a place called Beijing, which is just a few hours flight from Wuhan, had only around 200 deaths, whereas America had thousands of deaths, Italy had thousands of deaths. That's because they completely blocked travel. However, they allowed international travel from Wuhan, thus exporting hundreds and thousands of people all over the world and getting this disease spread like a wildfire throughout the world. So these are the couple of reasons what has made the whole world extremely angry on the behavior pattern of China. Now, this could be an accident that Chinese had no control of, but what they they did have control of, and they did not do it, is that they warned the people so that adequate steps could be taken, and this disaster, which has already killed more than 200,000 human beings all over the world, is and has infected more than 3 million people, is an extremely sad event, and this could be completely averted if we knew from the time that possibly China knew about this episodes that was late last year. Now, moving from the viruses and how it came, and I think this is important because it is important to know the behavior of the virus, because that will help explaining what we can expect. So obviously, it being a completely novel virus, we just don't know its behavior. Now, as you know, most bats live in dark, dingy places, which are very cold as well as dark, but very dry. And that's why it is expected that the virus will die, or at least the transmission will get reduced when summer comes. Most of the top virologists in the world completely believe this virus is there to stay. It is not going to go away. It will come back again. Even if it goes off or decreases effectiveness during summer, it will come back in winter again and have the same problem, unless we develop a drug or we develop vaccine to treat this disease of the coronavirus. But having said that, it is important to understand that it is important to understand that the virus has protein molecules. It's covered with a coat of protein, and inside that protein is its genetic material, which is um, a single-stranded RNA. So the single-stranded RNA covered by the protein is responsible for doing everything that the virus does. And this protein has something known as the S protein. This S protein is responsible for actually infecting humans. Now, let's go a little bit into that. So, the S protein is completely denatured at a temperature of 56 degrees centigrade. So, it is expected that in very hot summers, for example, in very hot summers in India, most of the cities, villages, as and also in southern part of America, you will find that this virus will possibly decrease. Now, this virus has been initially thought to transmit only through droplets. So, keeping 6 feet distance would make people safe. But now it is very clear that other than droplets, it also spreads by what is known as aerosol. So, let me explain that. Suppose I have COVID virus, and I do go to a room which has um, normal air and the doors are closed, or maybe I go to a shop, or maybe I go to a mall, or I go to a saloon, and in that saloon I have my hair cut. So while I'm breathing air, because I'm infected with COVID, because I may not have any symptoms, so people doesn't know I have COVID. Even I don't know I have COVID, but I can release the COVID viruses in that environment. Now, suppose you come there after, say, 1 hour or 1.5 hours, or even 2 hours, no, God knows how many, but scientists believe at least for 2 to 3 hours it's alive, and you get your hair cut in the same salon, you can get COVID from me, though I have left that salon 2 hours back because I let the virus into the air and the virus can hang as aerosol. And the third, even more dangerous way to do it is by touching handles. So when I go to a room, my office, I sit in a chair, I cough, and instead of using my hand to cough like this, I cough with my hand, and I use that same hand to open the door. And you come to that place in a few hours or even in a few days. Now we know the virus can live on metal surfaces for at least 2 to 3 days. So, because it can live in metal surface for at least 2 to 3 days, in that 2 to 3 days, it can infect you and you can get sick with the virus. Now, let's turn gear a little bit and talk about some of the new things that we know what the viral disease does. So, the best news is that 90% of you will never be infected, or even if you're infected, will never be symptomatic. So that is good news. Who are the ones that are going to be high risk? One is people who are older than 65, people who are males. Females tend to get less infection than males. If you have diabetes, if you have hypertension, if you have past history of stroke, if you're on any of the medicine that decreases your immunity, for example, if you have rheumatoid arthritis or SLE or any of the bone and joint diseases that makes you take medication that actually brings down your immunity. So these are, and even diabetes mellitus, if you have poorly controlled diabetes mellitus, that brings down immunity and you can get this virus more easily. Now, let's talk about people who get moderate to severe. So, some of the new things that we learned, and this is within the last 1 or 2 weeks, and I would like to share with you. What we discovered was that people who die or people who have moderate to severe disease, they actually don't die just because of the lung. They have severe heart involvement. And this includes young people. Now, the initial report from China reported that most of these people were older, who had moderate to severe disease, but from the Italian experience, from the Spanish experience, and from our own experience in US, almost 35 to 40% of people who are hospitalized due to COVID are actually young people, and some of them have no history of heart disease, no history of stroke, no history of any immunodeficiency. So it is an untrue that only older people get. Sometimes younger people for different reasons can get it, and I'll come to some of those. So, so most people who have severe infection have death, and heart is one of the biggest thing responsible for that. So we have seen what is known as myocarditis, which means inflammation of the heart. So to give you an example, if you give a small child a balloon and ask him to dilate it, he will pump in air and the balloon becomes from this small to this big. So a normal heart, which is the size of your own fist, your heart is the size of your own fist, swells up like a balloon to this big. And in there's been case report also that the heart ruptures, causing collection of blood in the space around the heart. And that has happened in young people, in young female 47 years of age with no known history of heart disease. They reported things like that happening. So there's massive inflammation of the heart, there's swelling of the heart, there's severe heart failure. So the other important thing that is important to know, and this we have realized in the last 1 week, is these people tend to have what is known as stroke. Why do they have stroke? Why do they have? They also have massive heart attacks sometimes, causing release of cardiac enzymes. The reason is it makes the blood clot. Now, how this virus makes the blood clot is still unknown. Why it causes stroke? It not only causes stroke in the brain, but it can cause coagulation inside large blood vessels. So, suppose the main blood vessel to your heart, there are three big blood vessels. One of them might get blocked, and you can have severe stroke and die from it. People have been found, young people have been found dead in their home. Older people have been found dead in their home with severe stroke in Boston. And the same story happens with other blood vessels. Your main blood vessel to the kidney may get blocked. Blood vessels to the heart may get blocked. And all this blocking of these blood vessels can cause severe damage to kidney, can kill the heart, and obviously kill the person. Now, we do not know how that happens. There is some indication that, and that's why this thought process has come, that this virus might do something that Plasmodium vivax or Plasmodium falciparum, the parasite that infect malaria and that cause malaria, does. So it can actually denature the heme. So remember, we carry oxygen because of hemoglobin. So initially, when COVID came, people thought that people were having severe breathlessness because the lungs was getting filled with water. Now, the water in the lungs is something called ARDS. So, because it's getting filled with water and other things, so people cannot breathe. Now we know that is not true. The nature of this virus is extremely dangerous. It does not cause exactly something like ARDS. Even if your lung is still has air, still you can't breathe. So in other words, let me explain it in this way. If I take you on a helicopter, on a plane, on the top of Mount Everest, without you climbing slowly over days so that you can get adjusted to the lowering of oxygen. So if I just take you in, say, half an hour on a helicopter and just drop you on top of Mount Everest, you will die, because that sudden fall in oxygen will kill your lung, will kill your heart, will kill your brain. And that is exactly what happens in COVID. Now, how COVID does this, we are not sure. But we have found there is some evidence that the hemoglobin molecule, which is meant to carry oxygen into the blood, into your heart, into your brain. Remember, you can go to the best restaurant and have the world's best food. You can have world's best vegetarian food, best non-vegetarian food, whatever you like. But your brain does not eat any one of those. Your brain lives out of oxygen. So if I can manage to keep your brain off oxygen, if I manage to keep your heart off nutrition, you will have a severe heart attack, you will have a severe brain damage, you will have a severe kidney damage, and that's how people die. It's called multi-organ failure. So the mechanism by how it does, we don't know, but that's one of the things that it does. The other new thing that there's a lot of new information, and I'll go to that, is the treatment part of it. I talked a little about the causes, the why people die, and the new discoveries that has taken place in the last 2 to 3 weeks. The other new part that is important is the medication. So where do we stand? So it's very clear that hydroxychloroquine and chloroquine, based on all the trials in the US, doesn't work. And on top of that, it is also very clear that based on one observational study, and it is not a randomized clinical trial, observational study from the Veterans Hospital in the US, they took 300 plus patients who are COVID positive and gave some of them hydroxychloroquine, some of them hydroxychloroquine plus azithromycin, and other people was not given anything. People who were given hydroxychloroquine, 22% of them died. 22%. People who had not given hydroxychloroquine and died because of COVID itself, only 11% died. So you cannot have a drug that is worse than the disease. So hydroxychloroquine looks like it's worse than the disease. And why? The reason is hydroxychloroquine can cause what is known as ventricular tachycardia. Hydroxychloroquine causes change in EKG in the heart. Both hydroxychloroquine and chloroquine, and also azithromycin, can cause change in EKG and make your heart go super fast, and you die in seconds. Even in America, where you can get an ambulance or a helicopter to come and pick you up after you make a phone call in, say, 6 to 7 minutes. In 6 to 7 minutes, 70% of people die because of what is this is known as sudden cardiac death. So you have what is called sudden cardiac death when you have hydrocortisone and hydrochloroquine and chloroquine. So after the president of America popularized hydroxychloroquine, Now, the National Institute of Health and FDA has given strong guidelines against people using these drugs by themselves. Doctors have been clearly explained that once you're admitted in the hospital, you're under regular doctor's care, you're under doctor regular EKG, and your heart is being monitored. Only then you can be given this medicine. Though it's how much effective it is, we don't know, but still they can try this medicine when you're under care. Because remember, you're in your house, you're taking this medicine from a pharmacy, and you don't know how your body will react. Maybe 9 out of 10 patients, it may not react and it is fine. It may act or it may not act. We don't know. Only French studies have shown it works. But American studies till now, including that reported in New England Journal of Medicine, the world's top clinical journal, has shown that it doesn't work. So keeping that apart, you out of say 10 people or 10 people out of say 100 people might die. So you might think that's a small number, yes, but what about the person who's actually dying? For him, it's not just a number. So, especially a drug whose benefit is unknown, I, as a cardiologist, would strongly recommend not to take it until you are under a medical checkup or you're admitted to a hospital. Now, after the next drug which possibly is playing a role is remdesivir. So remdesivir is an antiviral drug that was found to be effective against Ebola. The initial American trials show that it is effective. The first trial that came out was from China, but that's not an official trial. The trial was by the Chinese Institute of Medicine, and the drug company provided free medicine for the trial, but it is not an official trial. Official trials are going on in the US. The initial results seems to be promising. People have gone well. People who have severe, moderate to severe disease have come out of ventilator. But as I said, it is in still preliminary stage. Until these two trials come out, we don't know. The other two drug that is important is so let's is and I'll explain the immunology of the disease shortly. Is what is known as interleukin 6 inhibitors. This prevents what is known as cytokine storm. So what exactly happens in COVID? So there are three things can happen. COVID infects you, nothing happens, you don't know, the world doesn't know, COVID is gone, and that's 80% of the cases, to even 90% of the cases in some places, depending on the strain. In a minority of them, you might have minimal symptoms: fever, nausea, vomiting. Rarely, you might even have diarrhea, which is some people, instead of having normal flu symptoms like fever, cough, cold, have predominantly abdominal symptoms like diarrhea. So, if you have diarrhea, don't think it is because you ate something, it could be due to COVID also. Another striking finding that is found in lot of virus infection, but very much in COVID, is strikingly common in COVID, is that you lose the sense of smell. So you suddenly find that you cannot smell things. So that is very odd. It is found in other viral infection also, even in normal flu it may be found, but it's very strikingly found in COVID. So that's another warning sign. So what happens? So COVID, so this is what happens in 90% cases. The rest 10% cases, you're hospitalized with severe, moderate disease. And out of that, a percentage have severe disease, people go into ventilators. And till now, as you saw, hundreds and thousands have died. Basically, in places like New York, Italy, dead bodies were thrown around like a dirty piece of paper, like how after you finish eating in a restaurant, you clean your hands and just throw the paper. Like that, hundreds and thousands of dead bodies had to be thrown out because of the massive number of death. So the reason for this death is that some of these go into severe disease. They're on ventilators for 2, 3, 4 weeks, and then they die, and they are just thrown out because there are so millions and millions of cases that there's no time even to do regular last rites or do any formal rites on the dead body, but they are just thrown about like some trash in a dust bin, or just buried, and they go treating the next patient because all the beds are filled with COVID cases. So, what exactly the COVID does? So, after it enters the body, in some patients, especially in the high risk, as I told you, it manages to suppress the body's immunity. Now, how does body react to COVID? So, body has got two forms of immunity. One is known as basic or innate immunity, and the other is known as adaptive immunity. So, what is the basic immunity? So, every day you and I face millions of viruses, millions of bacteria, but we live through it. Why? Because we have a basic immunity that prevents these viruses from entering our body. Now, COVID being a brand new virus, it's a novel virus. Body has never faced COVID before, so we have no idea what COVID is. So our body uses innate immunity to prevent COVID from getting in. Now, as COVID gets in inside the body, what it does is it suppresses the immune system, and that's why when you have a new flu, you are sick within 3 to 5 days and you're well within 1 day, 2 days, or maximum 7 days, because your body fights the flu virus, kills it, and you're fine. But because COVID has managed to suppress your immunity, it hides inside the body and it invades your lung, producing hundreds and thousands of its own copies. The small viruses that comes out from COVID, we call that virions. It produces hundreds and thousands of COVID. By the time it's 2 to 14 days, the body suddenly realizes that it has been completely taken over by a evil alien viruses, and it has been completely enslaved by a dangerous alien virus. So then body starts hitting back. The problem is when it hits back, the hitting back unfortunately is not measured. It hits back with massive release of hundreds and thousands of chemicals, hundreds and thousands of body's army, that is the white blood cells, natural killer cells, they are sent. And these release dangerous chemicals like interleukin 6, which I talked about sometime before. So this cytokine storm, what it does is this chemicals that his body releases, this millions of blood cells that are sent to hit upon the viruses in the lungs and other places, does kill the virus. But the unfortunate story is it kills the person also. So remember this. So nobody dies because of COVID directly. People die because of your own body's reaction to the COVID. And this massive reaction that is mediated by interleukin 6 and other chemicals, we are now trying new drugs called tocilizumab and sarilizumab. These are biological drugs which will prevent interleukin 6 from working and acting. And trials are going on in this also. Now, I'll talk about one thing which I think may be a game changer for India. It's number one, cheap. Number two, India has got an excellent blood banking capacity. So India can provide and produce hundreds and thousands of patients who get infected with COVID, take their blood, produce plasma. Yes, I'm talking about convalescent plasma. So remember, convalescent plasma is not a cure. Now, it will act in some people, it will not act in some people. It is not a brand new drug or something that we are doing for the first time. It has been used more than 100 years since the time of Spanish flu, that is 1918. So, all that it does is so if you or I get infected with COVID and I develop antibodies, and that antibody is in the plasma. So antibodies are just plain protein that the body develops against COVID. So as I said, body prevents infection using what is known as innate immunity. That is basic immunity with which it fights everybody, not only COVID, because COVID is brand new. But once you get infection, the body produces targeted immunity. So at that time it is targeted against COVID. And those proteins that it produces against COVID, the highest amount of that is found in the blood for the next 28 days after COVID leaves your body. So, in that 28 days, if I can take your plasma and give it to another person, it might work and it might cure that person or at least relieve him from getting severe infection. And it has so that's called plasma. So the good thing about is plasma is cheap compared to the drugs, especially some of the other drugs like tocilizumab and sarilumab are extremely costly, and it may be difficult for a country like India or people to afford this sort of drug on a widespread level. Though antiviral like remdesivir, if it comes out to be successful, then we can use those medicines in India too. But for now, I think a good bet would be trying to use convalescent plasma. And convalescent plasma, as you say, as I said, is much easier to use. Now, does it work? Does it have problems? Yes, it does. It has problems, and it has. It looks like it does work. So, what are the problems? So, number one, you have to get people who have COVID, track them down, make sure they give blood from where the plasma will be taken out and their blood cells will be sent back, given back to their blood. So people are not losing hemoglobin or they're not losing anything. On the contrary, they are saving lives. And that needs to be the education that goes to everybody, that you're saving life without any loss whatsoever to yourself. Once that plasma, and any blood bank which is standard blood bank can do that, you don't need to have super sophisticated facility, and that plasma can be given to people who are super sick with moderate to severe. Yeah. Now, does it work? Yes, there are over 1,300 centers in America that is using plasma. Mayo Clinic has started experiment on the first 200 patients, and based on the report, people who have been severely ill, people who have been under ventilators, they have come out of ventilators. Because remember, in the first few weeks of the COVID crisis in New York, everybody who was in ventilator for a long time was dead. Everybody. That's why we have 60,000 deaths in America today. But now this is the first first treatment we have, which tends to reverse the disease, tends to bring you out of the ventilator. So it works. Now, some patient, but it's not a clinical trial. This is just observational trial. Now, clinical trial, as I said, is on hundreds of hospitals in the US. We'll have better results in the next 1 month. But I think for the beginning, if the number of cases in India goes up, especially in Bombay, in Mumbai, Maharashtra, Gujarat, Rajasthan, Madhya Pradesh, in those states where it is going up, Delhi, it may be a good idea to try to make up a bank of plasma, convalescent plasma that can be tried on patients. Now, what are the dangers? The dangers are that you have to make sure that the patient who you're taking from doesn't have HIV, doesn't have hepatitis B, doesn't have hepatitis C, because you don't want to get another infection. And that is easy. Most of the blood bank do these tests already. So you have to make sure that you do this test before you take the blood from a person, to make sure that he doesn't have HIV, Hep B, Hep C, and all these things. The other important thing that is important to say out here is this: that this um, um, convalescent plasma might sometimes cause reaction because it's a body protein in patient who it is given. So that's why not everybody may be a candidate for the convalescent plasma. Now, let me change gear a bit and talk a little bit about the infection, about the herd immunity, and what we can do to protect ourselves from this dangerous virus. So, two things we have come to know. One is the actual infectivity of the virus, maybe even 60 to 80 times more than what it is today. So a study from Stanford has come out that shows it can be as much as 80 to 85 times more than what we know today. So the virus is highly infective. In Boston, where they had a shelter with homeless people, out of I think 300 people, 150 or 160 were known to already have the virus, though they were asymptomatic. Same is the story with California. So virus spreads like wildfire. It's a highly infective virus. It can go. So is this a good news? Is this a bad news? In general, this is a good news. Why? What it means is two things. One is that it means that the herd immunity, which means herd immunity means when a large amount of population already has the virus, you tend to get resistance against the virus. So when you're in India, You don't have to take a malarial drug as prophylaxis. But an American goes to India has to take anti-malarial drug. Why? Because you have herd immunity against malaria. You have herd immunity against typhoid. American going to India will have to take an injection for a typhoid because they don't have herd immunity. So herd immunity is extremely important. It is believed that with this amount of infectivity, we will reach herd immunity very quickly because until we get a vaccine, the only way to protect against the virus is staying locked down. But you cannot stay locked down forever. America has already has 22 million, from almost zero to 22 million people who are jobless. The economy is breaking down. And I'm here in India, the same thing will happen. There are tons and hundreds and thousands of people in India who are below the poverty line, who are migrant workers. You cannot keep them locked down forever. The fact that government has taken a very important step of locking down, I think India has played one of the best roles as far as locking down. Because remember, till now, there is no medicine, there is no vaccine. The one thing that needs to be done is keeping ourselves locked down, and that's something India has done tremendously and an excellent job. And that is the reason why New York failed. But some places like California succeeded. California went for severe lockdown, and that's why California had more cases in New York when they started, but California never had so many deaths, and it plateaued out. But New York, as you know, had thousands of deaths. One third of the cases from all around the world is almost in New York. And the reason is this: one is the lockdown started late. Number two, hundreds and New York is a tourist spot. Hundreds and thousands of people came from China who were infected, who did not know they were infected because flights were not stopped. Even when America stopped flight, China, despite knowing the fact that Wuhan was a center where millions of people were getting infected, they complained. Just like they used their muscle against a lot of small countries when those countries stopped flights from China to say, "Why are you stopping it? This is racist." So they not only lied, they actually helped forcing the infection in a lot of places, particularly in America. And that's what has got a lot of American people extremely angry. And a lot of people in UK and Germany, Australia extremely angry because they had to suffer because of the Chinese lies. So if you because India has had a strong lockdown, it is possible that the number of spread has been low compared to other countries like America or Europe. It may also be that the strain of virus is different, but we don't know. So now the fact that I talked about the virus, its treatment, its spread. So what does that mean? One thing is the herd immunity will come quick, and that is extremely good. But then how can we protect ourselves from this virus? I think we can protect from this virus scientifically by practicing yoga and meditation. I'll tell you why. There has been a ton of studies of people practicing meditations. As you know, yoga doesn't mean doing only asanas. Along with asanas, you have to practice meditation. When you practice meditation, in 2014, there was a study which shows all that IgA is a chemical that lines our lungs, lines our gastrointestinal tract, and it prevents attack by viruses and bacteria. So if your IgA is improved, as it has been shown by practicing 4 weeks of pranayama meditation along with yoga, you will find your innate immunity that is used to fight COVID will increase. And this is not one. There has been 3, 4 studies. Like there's interferon gamma, interleukin 12, the multiple other chemical, interleukin 6, which is released and actually may be responsible for the death. Because as I said, COVID doesn't kill; it's your body's massive reaction that kills. So, in simple words, like using a term that is very commonly used in India, is you have a mosquito that is biting you, and to kill the mosquito, you bring an army tank, a Arjun battle tank. So the mosquito obviously dies, but you die with the battle tank firing at you. That's exactly what the body does. The body is firing battle tank grade ammunition against virus, which unfortunately does not only kill the virus but kills the human being also. In a study in 2017, and a study in 2014, in a study in 2016, meta-analysis does done on patients who are normal, patients who have cancer, and they practice meditation, showed that that meditation and yoga can actually prevent the extreme release of interleukin 6. There's something called ILS induced interleukin 6 release. Those can be prevented by yoga. The other thing which is very important is during lockdown, you tend to get anxious, you tend to be depressed, and you tend to also develop panic attack. What happens if I have yoga? If I have COVID? What happens if my son has COVID? What happens if my older father or mother dies of COVID? So all this relates to extreme anxiety. All this relates to extreme depression. Now, and this anxiety depression, remember, is not only in your brain, because the physical expression of this anxiety is depression is your immunity goes down, and you actually open the gates to more infection, more COVID. So you're opening the floodgates of your immunity to enable infections to take place. So it's like a double-edged sword. Not only are you depressed, not only are you anxious, not only are you getting panic attack during lockdown, but the whole process also decreases your immunity and makes you more liable to get infection, including COVID. So a practice of 15-20 minutes of basic asanas, then doing pranayama, which is deep breathing, and then practicing meditation will not only increase your innate immunity and decrease your chance of getting infections. And this has been proved by multiple clinical trials in the West by people who are not Hindus, who are not born in India, who have no relation with India, but they are just physician scientists who wanted to see the role of yoga and meditation. And they have shown that it has a powerful role in in increasing your innate immunity and bringing down the chance of you getting infected from a wide variety of viruses and bacteria, and possibly also COVID. We don't know. We need to have trials. There are multiple trials going on. I am involved in some of those to see what it does in actual COVID patients and in patients who are staying home in lockdown state to prevent them from getting COVID. But the other important fact is, suppose you do get COVID, as I said, there's nothing to get worried, because 90% of people will might have COVID, will be completely asymptomatic or mildly symptomatic. They don't have to go anywhere. They can stay at home and they'll be fine, having no problems at all. But in case you do get COVID, practice of meditation and Anga also, as I said, causes modulation of your immunity. This fire that you start in your body to kill the COVID, which finally ends up killing you, is stopped or may be stopped by using meditation, because meditation modulates your immunity. It buttresses up your immunity, like your innate immune function, your antibody release when required. It also decreases unwanted immunological reaction, which is sometimes common in the body, and it's found not only against COVID, it's found in many other cases like rheumatoid arthritis. SLE, in these immunological diseases, the problem is not the disease. The problem is your own body. Your own body releases chemical that eats up the bone, that breaks your bone, and that's why it's your body which is at problem in all the immunological diseases. So COVID, now since we know the molecular biology and the mode of action, as I just explained to you guys in a simple term, we now know that meditation and yoga practice can actually help to block this process. And so even if you get COVID, maybe you can guarantee that you will get only mild or be completely asymptomatic. In the first place, you may be protected if you practice. And that's why I think people who have been practicing yoga and meditation for a long time, and there may be hundreds and thousands of them in India, or maybe millions in India, they may actually be protected from this disease. So I'm going to stop now, and I'm more than willing to take questions. So feel free to ask me questions. We'll take questions for around 10-15 minutes. and then I have to rush to the hospital. Unfortunately, this is my early morning, and I'm a frontline worker, so I can't. I'm not lucky enough, like quite a few other people, even here in America, to stay at home. As you see, I'm completely dressed, just waiting to go to my hospital. So go ahead. If there's any question, I'm willing to take questions. Please type in your question, and then I will answer them one by one as I get them. Yeah, so one question is pranayam like Vastrika, Kapalabhati, Anulom, Vilom. Yes, any sort of pranayam is, you don't even have to do something like Bhastrika and all, because those might need, especially older people having heart disease, it may not be inappropriate. But practicing simple pranayam, which means taking, so basically what I expect is you sit in a straight position, keep your spinal cord completely straight, and turn your eyes upwards, which is what we call the supraconscious glands, and then close your eyes and then take slow deep breaths like what I'm taking now. And then you can slowly release it. You may not be able to take this long breath, but try to take in as much as you can without hurting your lungs. And this needs to be done at least 7 times. So sit in a nice place. You can keep your spinal cord straight and take slow, deep breath. Breathe in and breathe out. We can do maybe a practical demonstration some other day, but basically that do simple physical asanas at your home, like a Surya Namaskar. Just once a day is all that is needed, but it's good to practice this at practice meditation techniques like pranayama, a little bit of dhyana. Try to get mindfulness, which is called dharana, and also dhyana, which is meditation. Concentrate. You can try at least couple of times a day, since you're at home and not busy, not going to work, and that, I think, enough to increase your immunity. Okay, what food we should take to prevent COVID? There is no known food that actually prevents from COVID, as I said. But there are a couple of important things to understand. One, understand is, you cannot, you have to take fresh food. Now, if you by chance have a packet delivered outside, make sure you don't take that packet inside, touch it with your hand, and then touch everything, because that it might carry COVID. So a packet that is delivered outside, make sure after you touch it, you wash your hands. Secondly, try avoid eating cold food from the fridge. If there is COVID there, it might get in. So if you have food in the fridge, make sure it is warm. Try to eat warm, freshly cooked food as much as possible. Sometimes it may not be possible to cook every day, that is fine, but eat cooked fresh food. Try to avoid eating too much, because eating too much is will cause problems. Which cause gastric problems, it might cause heartburns, and so those are a couple of things. So this is the maximum about food. Role of somebody's asked about Ayurvedic medicine. I'm not Ayurved, so I cannot comment about Ayurvedic medicine. But I think Ayush is there in India, and they are giving directions. So feel free to take directions from Ayush. I'm not in a position to give you but what I would give is, I can, as I gave you the latest science, I gave you the latest medicine on allopathy. And I also gave you the fact that our 10,000 years old practice of yoga coming from Maharishi Patanjali is all that is required. You don't have to follow a particular guru or anything. Even Vivekananda, Adi Shankara, everybody said that all that they are saying didn't come from themselves. It all came from the Upanishad. It all came from Patanjali's Yoga Sutra. So you just have to sit and practice by yourself, and that's all that is required to increase your immunity. Vitamin C, is it helpful? Yes, vitamin C. Unfortunately, there's been a lot of trials, hundreds of trials with vitamin C. There is no proof till now that it helps. There is, in some trial, it is plus minus. It might help against some flu virus, but around COVID, there is absolutely no proof that it helps. Yeah, is there a way to reduce intensity of cytokine storms? Yes, cytokine storm, and that's why we are trying two new drugs. One is tocilizumab, which is an interleukin-6 inhibitor. So the cytokine storm is initiated by a bunch of chemicals like interleukin-6, interleukin-12, interferon gamma, but the main culprit we believe is interleukin-6. So there are two drugs in the market that's being in trial in America. One is tocilizumab, one is sarilizumab. So medically, that is the latest I have for you. Different hospitals have it. We have it also, but it's in trial. So you can put the patient on a trial and see if it's working. And at a personal level, as I said, people who have been a practitioner of yoga and particularly meditation, there's been trials which actually shows that you can prevent yourself from getting you can modulate the release of interleukin 6. Now, whether that is translatable to what happens in COVID, we don't know. But obviously, there are trials coming up that tends to see the role of yoga and meditation in COVID. But there are very strong trials as I said, done by Westerners, not by people in India who may be biased. And that shows that meditation plays a very strong role and can really decrease the release of interleukin 6, which is more harmful than useful in multiple conditions like rheumatoid arthritis. And certainly in COVID, since now we know the way that the virus functions. How to induce the genome research? Again, I don't understand what that means. The genome, we know the genome of COVID, it's a single strain RNA virus. So, Mr. Bose, please restate your question. I'm not sure what exactly you're trying to know. Can plasma therapy be made worldwide? It is already worldwide. Five countries, if I'm correct, to this moment: United States of America, Germany, UK, Italy. It's already worldwide. Five countries all over the world are doing it. India, I heard they had one case, but I am expecting more and more cases to be done in India too. As I said, India has got a strong blood banking system. Indian government has taken excellent step by bringing in lockdown, so it can use this. Since we have less number of cases in India, this is the best time to build up plasma so we can do it. But be warned that plasma is not a cure. So all that you are doing is, in severely sick patient, you're giving means to fight the COVID. So when you give them the plasma helps to do away with the severe COVID infection. The body's reaction to COVID, as you know, and I just explained, is what causes the sickness. So obviously, when you control COVID, when the number of COVID reproduction comes down, body's reaction will immediately come down, and that's how people have got out of ventilators, who have been in ventilator for a week or more, people who are severely ill, who would have died even 3 to 4 days back, now on therapy, have come back. But listen, as I said, it works in some cases. In some cases, it does not work. It has its own problems. But having said that, other than lockdown, which is prevention, practicing health hygiene like self cleanliness, washing your hands multiple times a day, having simple sattvic food, not overeating, regular practice of some form of mild physical exercise like yoga asanas, and regularly practicing meditation is all that we have. So plasma is the first medicine, not the first sort of treatment that has shown some effect. Other medicines that has shown effects are still in the process of being in clinical trial, like remdesivir. But as I said, the first trial in China was negative, but that is not original trial. Plus, the drug manufacturer has said the trial was not well done, not appropriately done. So we have to look for trials taking place in Western countries, which have a higher scientific standards to know if these drugs are working. So for now, these are the plasma. So another very good question, and it asked who can donate plasma. So here, so number one, you should be you should have a COVID infection that is proved by doing PCR. That is number one criteria. You should be symptom free for at least 14 days. If you are symptom free for 14 days, then you need to do antibody test to make sure you have enough antibody. Plus, you need to do another PCR to make sure that you're free of COVID. Then your blood can be taken. The other option is you have to have COVID proved by doing a PCR, which is the most reliable test. Then you have to be symptom free for 28 days before you can give plasma. If you do it 28 days after you're symptom free, then you do not have to do another test to prove that you are free of the COVID. That is, you don't have to do another PCR, but you do have to do another antibody, because you have to do one antibody, because why would somebody take your blood and your plasma if you don't have antibodies? So remember, if you are free for only 14 days, you can still give plasma, but you have to take another test to make sure that you're COVID free, so that you're not giving COVID to somebody else, along with the antibody test to make sure you have made enough antibody. Otherwise, your plasma is useless. The second question, the second part is, in case you give it 28 days after you have COVID, you're asymptomatic from COVID, then you do not have to repeat your PCR, but just do antibody, make sure you have enough antibody, then you can be a donor. So the question that was how to go through genome sequence to edit the decode. Well, there are the genome is already there. The nature has published it. It's there everywhere. If you are trained in molecular mechanics, you can do it. So that should not be a problem. Virologists are already doing it, trying to develop vaccine. Okay, a lot of people have given me well wishes for being in the front line. Thank you very much. But that is my job. I'm a physician. Um, um, what do you think about the subtypes of coronavirus? There's nothing called subtypes. You see, that any RNA viruses can change strains, because there may be mild changes in their RNA structure. There can be changes in their protein structure. So there's not really subset a different strain, and it's very easy for these viruses to change strain. But it's not really, as far as the A is concerned, we know there are different strain, and some people believe India may be having a weaker strain so that the infection is less, but we don't know. I mean, it's best to get prepared, because sometimes what might happen is the infection came in late, or we don't have that many cases in India, because the government of India has taken an excellent step to bring out a complete lockdown, despite people trying feverishly to some people trying feverishly to break down the lockdown, which is very unfortunate, despite best of government tries. And again, India, I think, re-extended the lockdown till early May. So I think those are a good step that has prevented infection spread. But we still don't know what will happen if really India has a weaker strain, or maybe India has equally potentially bad strain as in America, but because of government steps, it has been protected, and it may not get protected once the lockdown is taken over. But again, as I explained, that you cannot have lockdown forever, because a lockdown has very severe economic consequences, and that severe economic consequences can be even more long lasting than the COVID itself. So what I say is this, that you cannot have a disease, you cannot have a treatment that is worse than the disease. So the treatment that is locked down cannot be so long that you have economic recession, and thousands of people suffer, or millions of people suffer from it, or millions of people die from it, just to protect yourself from COVID. So your disease, your treatment cannot never be can never be worse than the disease. So I guess the government has to take appropriate steps if it wants to increase, or if it wants partial reopening. That depends on the local situation, local economy, local behavior of the people, and I guess appropriate steps will be taken by the government based on that. Um, Somebody has asked about clinical trials going on in India to give my comments. Unfortunately, I don't have detailed records of the clinical trials. All the clinical trials, people who have sent me clinical trials, I can only give comments about that. And obviously, this is not a forum, public forum, to give comments about clinical trials and other things, which has you have to maintain appropriate protocol to do that. It cannot be publicly advertised or publicly told. But so I unfortunately don't have privy to all the clinical trials. Those I have passed on my opinion. Under what condition resurgence of infection occurs in cured patient? Very good question. Honestly, we don't know. Now, there has been resurgence. 91 cases in South Korea has been shown to have reinfection with COVID. In China also they have shown. Now in China the problem is we really do not know if it was really a reinfection or if their test kits were bad. Maybe initially they showed no infection, that was because of bad test kits, and then they showed positive again. So for China we cannot say, but for South Korea, which has got an excellent medical system, a very good research system, as you all know, they actually published data that they had 91 cases in a trial who actually had reinfection. They had COVID, the COVID was completely gone, the PCR was negative, and they had COVID again. Okay, some questions about other rapid antibody test. Yeah, so as you know, so rapid antibody test is the one coming up in the US. There's been problem with some tests, but we need to have more rapid tests for different reasons. So now, as you know, the typical PCR, you have to go deep inside the throat, the nasopharynx, and take swab. So the problem with that is, number one, it is uncomfortable for the patient. Number two, it is dangerous for the health worker, because you must have seen in TV in America, the cars are getting stopped, the windows coming down, and health workers taking nasopharyngeal swab from people. But when you try to get into somebody's nasopharynx or deep inside the nose, you can cause severe vomiting or severe cough. And if you are COVID positive, you'll throw in a bunch of viruses at the healthcare worker. So it's a dangerous thing. So now they are developing new tests, like for example, the salivary test, where all that you have to do is you don't even need a healthcare worker. You take the swab and you lick the swab, you touch it all along your mouth, in your tongue, and then you put it in a test tube, close it, and you can mail it to the center or give it to the healthcare worker. So the healthcare worker's life is not in danger while he or she is trying to test you. This is one type of testing that is coming. It should be in clinical A in the next couple of weeks in the US. The other important thing is time. Initially, we took us 5 days to get a PCR. Now it is reduced to 1 day. Now we are coming couple of other tests, like using antibody, using antigen, like part of the virus, not actually doing PCR, to generate if the virus is still there. And those can be done as quick as in 15 minutes. But you have to have the right kits. As you know, a lot of kits coming from China, not only to India but also to France, New Zealand, Australia have been sent back because their quality is extremely poor. So it's important not only to have, we have the technology now to do a fast test with an answer in 15 minutes, but all over the world, including in America, there is an attempt to increase the number of kit being produced so that we can do appropriate tests. Everywhere in the world, appropriate number of tests is not being done because we don't have enough kit. So there is a massive move even in the US and I guess also in India to increase the number of testing places appropriately. So pranam to all. I will have to go for today. Thank you very much for being with me. I'll be more than happy to answer more questions. You guys can take down my email and get in touch with me. This is my email. I'm typing you my email. Feel free to get in touch with me and we can talk further. Thank you. Namaskar, everybody.